Dear President, fellow experts, my name is Yaping Bai. I'm from the Xiamen Cardiovascular Hospital in Xiamen University. Uh, I'm honored to have the opportunity to attend the Florence Nightingale 2020 virtual conference. The topic of my presentation today is the construction and practice of an unaccompanied cardiovascular hospital management model, and the conference track is World Health. Now, I will make a brief report from the following 6 experts. Part 1 Basic Data. The Xiamen Cardiovascular Hospital of Xiamen University is the only public tertiary cardiovascular hospital in Fujian province and the most influential institution for the diagnosis and treatment of complex and critical cardiovascular disease on the west coast of the Taiwan Straits. The completion of a project requires the collaboration of multiple teams, including the director of the nursing department, vice director, director of medical administration department, deputy director of the official of the party committee, deputy director of the office, director of security and defense department, financial department, and 2 officials of the nursing department. As we know, China has a high mortality rate from the cardiovascular disease and a heavy burden of care. In 2016, the total number of deaths of Chinese residents was 9.67 million, among which 3.975 million deaths were caused by cardiovascular disease. Unaccompanied care has played a major role in COVID-19 prevention control. If a patient is accompanied by too many people, it may affect patient's rest and hospital diagnosis and treatment order, increase the risk of nosocomial infection and burden of family care. In 2019, it coincided with the relocation of our hospital to a new area. Last, guided by national policies, we are the first to carry out the unaccompanied management model in Fujian province to develop the corresponding solutions. There are 5 goals in our hospital. This project is changing the traditional view of patient's family, dispelling the misgivings of patient's family, satisfying patients' high-level demands, forming a rehabilitation team to provide rehabilitation care service, providing an accompanied service for patients at an affordable price under the premise of ensuring the hospital's continuous operation. There are four stages in this project. There are planning, preparatory, implementing, normal operation stage. In first planning stage, we consult literature and determine the topic. We prepare and build a team, determine the construction plan of an accompanied hospital, and set out the responsibilities and policies of departments. We design and plan the traffic flow in new hospital area and optimize hardware equipment. We introduce a nursing personnel team, and we form a rehabilitation team. We explain the concept of unaccompanied service to patients. We manage the budget of unaccompanied service. In the second preparatory stage, we hold a public hearing to gather different opinions and suggestions. Give an explanation of unaccompanied service to all staff, patients, and patients' family. And we establish the processes and system of unaccompanied service. We set up the trusted standard of unaccompanied management. We improved the training and assessment of nursing personnel. We improved patient safety management. And we introduced catering companies and nutritionists. We introduced a medical examination accompaniment team. We add software and hardware equipment. In the third implementing stage, we strengthened the publicity of unaccompanied service inside and outside the hospital to change people's traditional view. We reshaped life care, medical examination, accompaniment service, food service, post-operative rehabilitation, and visit management based on an accompanied management model. We normalize nursing personnel management, adopt the group-based holistic nursing, an all-year-round regular training system. For service quality management, a street-level quality control system, namely group leader project management quality control is adopted. The legal rights and interests of nursing personnel will also be protected so that the nursing personnel team can be stable. We ensure the safety of patients and improve nursing quality. In the normal operation stage, there are 4 tips. Um, there are reshaped hospitalized process, standardized therapeutic diet, intelligentized nursing quality control, and continued quality improvement. Our hospitals have taken the lead in implementing the unaccompanied hospital management model, which has been widely reported by national, provincial, and municipal media. Results of researches on the unaccompanied management model that have been carried out are projected among the 2020 Health Policy Innovation Projects of Fujian Province has been approved. The abstract of relevant thesis was accepted for concurrent session of an international conference. The Continuous Quality Improvement Project was granted the Excellence Award. We have applied for 6 patents, of which 2 have been approved. In 2019, for the overall satisfaction with hospitals, our hospital ranked second among 62 tertiary hospitals in Fujian Province, first among 13 specialized hospitals, and first among 26 secondary and above hospitals in Xiamen City, as shown in Figure 2 to Figure 9. This picture means the unaccompanied management project among the 2020 Health Policy Innovation Projects of Fujian Province has been successfully approved. This picture means TWINC 2020 Acceptance Notice. This picture means that the certificate of 2019 award for excellence project on continuous improvement of nursing quality. During the implementation of an unaccompanied management model, the nursing department has applied for 6 patents based on the survey of patient satisfaction, feedback, and the occurrence of adverse effects. 2 patents have been approved. And the patient satisfaction ranking top. The unaccompanied management model has been promoted and publicized, which has aroused public concern. It is promoted both online and offline. The online meeting was held on February 28, 2020, for the implementation of COVID-19. The meeting emphasized that the unaccompanied management model has a decided advantage in preventing cross-infection, and a total of 16 hospitals and 15,270 people watched the live broadcast online. About 74 of thine students from 23 hospitals across the country have learned about the model, which has been promoted to one hospital as shown in Figure 10. Unaccompanied management has created a good environment for inpatients, improved their experience, and significantly decreased the incidence of infection and medical disputes, thus increasing inpatient satisfaction. During the prevention and control of COVID-19 in 2020, unaccompanied management model, which indirectly reflects that unaccompanied management is important for hospital infection control. Since its implementation, the project has received much positive media coverage and has been successfully approved as a provincial project with multiple national patents. In addition, the abstract of relevant thesis was accepted for concurrent section of an international conference and other honors actor. Thank you.